Dr. Cullen, first, I would like to thank you and Jenny and Erica for taking time to come out and talk with us about such a vital issue in our community. So first, I want to thank you for that. And we look forward to working with you in the future to make sure that African Americans, in particular, because that's the community we predominantly serve, is able to receive the vaccination and whatever other health issues that we're able to address. But I thought before we would begin, because all three of us are pastors, let me introduce Pastor Elwood McDowell. He is pastor of the Trinity Missionary Baptist Church. Pastor Amos Lewis is the pastor of the Rising Star Baptist Church. He is also the president of the Paradise Baptist State Convention and the director of the Ministers Alliance Community Action Team. And my name is Grady Scott, and I'm the pastor of Grace Temple Baptist Church. And we are glad that you were able to share with us today. Before we begin, I'm going to ask Pastor McDowell if he would lead us in prayer.
God of heaven and earth, we come at this hour to share information about health and wellness in this community. We ask you to bless us with wisdom and understanding so that we can be useful in this effort. We thank you in Jesus' name. Amen.
Amen. Amen.
Dr. Cullen, one of the things that we are hearing a lot is a hesitancy in the African American community to get the vaccine. I'm finding just in my conversations, and of course that's empirical, but it's not all inclusive. I'm finding that the seniors are not as concerned about the vaccine as the younger people. And I'd like to know if you could address some of the myths that are being circulated and what kinds of things we can do as a community to stop that.
Well, first off, thank you so much for letting us have this dialogue with you. We think it's really important to continue our outreach to the community to make sure we continually educate the people in the community. So to answer this question, I think what I'm going to do is start first with the science. You know, we have repeatedly said that we are data-driven. We are science and data-driven. And the science about the vaccine, I think, is really critical. There's some misperception because the vaccine was developed fairly rapidly for a vaccine and then was distributed fairly rapidly. What's important to note is that the vaccine did go through all the normal processes prior to being approved by the Food and Drug Administration, the FDA. Both vaccines that are available right now, Pfizer and Moderna, both have what we call an EUA. That's an emergency use authorization. The reason why they have an EUA is because of the rapidity with which we wanted to get it produced and distributed to the community. As you know, we follow closely any kind of side effects. We're seeing very few side effects. We're seeing increasing data that supports the fact that the vaccines are highly effective, 85, 90, 95% effective at preventing the disease and subsequently preventing morbidity, which is what the disease does to you, and mortality, which is death. So there are few side effects, highly effective, distributed in a very reasonable and what we would normally use as a process for immunization distribution. Now, one reason the vaccines were able to get out so quickly is the United States did do a different thing this time. They developed the vaccine and put in process the infrastructure that would be needed to produce the vaccine. Normally what would happen, people would develop a vaccine, it would get approved, and then you would put that infrastructure in place. That infrastructure, however, has been in place for decades for the other vaccines we use, many of which you're familiar with, the flu vaccine, or if you have children, any childhood vaccines. So I want to reassure everyone that the process that was in place at the time the vaccine was developed, the way it was evaluated by the FDA, and its production meet all of our normal standards. In Pima County, we have distributed over 200,000 vaccines right now. Our side effect ratio is really infinitesimal. In fact, we can barely monitor it and record it because there's so few people that are recording side effects. And yet, at the same time, we're seeing a significant decrease in our cases. We think some of that is due to the fact that over 200,000 vaccines have been given into the community.
There were no long-term studies. That's the question I just read from one of our young people that says, there's also, let me find it again. As of now, there are no studies on the long-term effects of taking the vaccine for COVID-19, and it's been reported by there have been reports of numerous reactions and reports that the current vaccine does not is not effective against the new variants.
Yeah, so let me respond to that. It's accurate. There's no long-term studies. It's a relatively new vaccine, but we monitor, the county, the FDA, the CDC monitor on a daily basis reports that come in, and there's multiple ways that reports come in. One of them is a thing called Vaccine Adverse Effect Reporting System, VAERS, that most physicians or healthcare providers contribute to. We're not seeing anything that makes us concerned right now. There's no spikes of a side effect or anything like that. And we actually at the Pima County Health Department work very closely with the state. If we have somebody that asks us a question and we're not sure about, we go to the state expert in immunization. So I think people should be reassured that in the period that we've been using this vaccine, we're seeing nothing that makes us concerned that there will be long-term side effects. The country, the county, individual providers will continue to monitor and record those side effects. If there is anything that comes up, we will make sure that the public is aware, but right now there isn't anything. In terms of the new variants, that's a really important question, the new variants. As they develop, there is ongoing evaluation of the effectiveness of the vaccines against the new variants. As you've heard, there's this emphasis to try to get as many people vaccinated as quickly as we can, with the belief that that vaccination itself will decrease any impact that comes from the new variants.
I'd like to also introduce Carolyn Anderson and Apostle Warren Anderson, the Living Water Ministries. They're the church that's right on 22nd Street, across from burned out Golden Corral.
Okay, they can edit that out too.
Okay, also there's and guys, feel free to jump in. I just had some questions. One of the other questions is about the vaccines altering your genetic properties.
Oh, yeah. I think there's some confusion about that, because when we talk about genetic variants, which we talk about a lot, those are any kind of mutation that may have happened with the vaccine itself. As an individual person who receives the vaccine, there's no genetic variance. It doesn't change anything in your body. You can think of it as if you've ever gotten a flu shot as an adult, or a tetanus shot if you had a cut in the past. Those are vaccines just like this vaccine. There's no possibility that they change your body itself. What happens is your body develops the immunity to that disease itself.
Well, I appreciate you guys coming out to Rise and Start. You guys scheduled to come out this ride on the 26th of February from 9 a.m. to 3 p.m. And I got some questions for you. Once I told people that you guys would be in the community, and of course we're trying to really get black and brown bodies to get the immunization, the vaccination. People want to know which vaccination would you guys be giving out at that particular time.
So we, in the community, we give the Moderna vaccine. And the reason for that is, you may have heard the vaccine that's needs real cold. That's the Pfizer vaccine. So the Pfizer vaccine has to have these ultra cold freezers. So we don't take that out in the community. Any community-based mobile vaccination we're doing with the Moderna vaccine.
Another question I had, they wanted to know if they showed up, because you said 65 plus, law enforcement, school teacher, clergy, right on down the line. They want to know, did they have to have proof that they were clergy or law enforcement? Would you have some type of ID? How would they go about it?
You know, we do ask for people to have some identification, but it could actually be a letter they've gotten in the mail that has an address on it.
Okay.
So there's no proof. We rely on the trust of people and knowing that those are the groups we're trying to serve right now. And for those of your members who may have been paying attention all throughout, you know, at one point we were 75, then we dropped to 70, but you're right. 65 and over is who we want to serve: law enforcement, teachers, protective enforcement, anything that falls into that, as well as healthcare workers. Actually, pastors have been eligible, anyone who ministers to the sick. We've tried to ensure that they can get adequate vaccination.
Right.
Of course, there's some skepticism because Bill Gates is engaged in promoting the vaccinations, and one of the things that came out first was that they were going to try it in Africa. And of course that caused people to say, okay, wait, why are you doing it here first? And so that's spread into the African American community. Like, why is this person who has we both went to medical school the same day, so he has no medical school training. So how is
I missed that.
So the question then becomes, how does someone who is not medically trained become so involved in the vaccination development?
Yeah, I think it's a really good question. So let me answer based on what I know. So I think Bill Gates' involvement and engagement, independent of where the vaccine should be tested, is because of his commitment to equity and wanting to ensure that people's lives are saved. And what we know is this vaccine can save lives. As we know, we have over 500,000 people dead in the United States right now. Pima County has over 2,000 people who have died, succumbed. You know, our hospitals were full for December and January and into February. So we've seen really significant impact of this disease itself on our community. And we know that people of color have suffered more than other people. We just have to acknowledge that. African Americans, American Indian, Alaska Natives, Hispanic populations have died and gotten the disease at a much higher rate than any other group in the county and in the country. We also know that those groups are the groups that have been less likely to be able to get the vaccine. In Pima County, our numbers are better than they are in the rest of the US, but it's not equitable. When we look at what our population is by race and ethnicity, and then we look at who's gotten the vaccine, it's not the same amount. I think most of that is due to access. It's not necessarily due to concerns, but I do want to acknowledge Tuskegee. I actually was an active duty public health service officer. The Tuskegee syphilis study was done with active duty public health service at the time it was conducted. And so I think we have to acknowledge that there is real history of racism and genocide that occurred with research in the past. In this case, I see no indication that that is going on, and I want to reassure the members of every community that had been adversely affected by this disease that there's no indication, and there's nothing from me as a physician and as a scientist that makes me concerned about the integration and the utilization of the vaccine in any community. So hopefully that, and I do think you're really right to put that up. Like, why would you vaccinate in Africa first, right? Is it because the value of African is less than the value of another person? But the reality is that that's not what happened with the testing of the vaccine. And you know, there were actually you may not know this, but in Tucson, there was an arm of the vaccine research. Oh, yeah. There were many people in Tucson that actually were enrolled in their initial research studies around the vaccine.
Well, that was one of the questions I received as well. What are you guys doing to make sure it's more accessible to people of color? I mean, I know it's going to be at Rise and stuff, but they want to know would it be at other churches be doing like testing for COVID-19 as well as to having the vaccinations there.
Yeah, I think I'm going to turn to one of my partners and let them answer that question.
So we have a grant that you just mentioned for the testing component, which is mitigating COVID-19 in communities of color. I know I don't speak very loud, but can you hear me?
Yes, I can understand what you're saying.
You have a real good mask.
I know.
It's the Pima County Health Department.
It's supposed to be, passing germs, but anyway. That grant focuses on bringing COVID-19 testing out to communities of color so that we can mitigate the impact within our communities of this disease. And so we have been using that model to develop another plan to distribute the vaccine equitably out in the community as well. And so along with Jenny and Dr. Cullen and some other partners, we've created a whole vaccination plan that specifically will focus on areas of Tucson that are hardest hit by the virus and get that vaccine out so that we assure equitable uptake. A big piece of this part, though, is education. And I think it's really important that in order for our communities to want to take or get the vaccine, is that we're educating people, and so that they're able to make informed decisions, and that we're not allowing other groups to utilize our trauma to strengthen their own platforms to not get vaccinated. Because there are groups out there that want that. There's these anti-vaxxer groups, and I don't know if that's politically correct. Talking about that, but there's groups out there that are anti-vaccination that really are using the historical trauma from other communities to strengthen their platforms so that they're creating vaccine hesitancy. And so what we need to do is educate so that people can make informed decisions.
Okay, awesome.
Okay, good. I wasn't sure if we're assigned or not. We said we would be, but we haven't gotten any information. Are you the one?
It was more for testing than vaccinations, but we had talked about vaccination test site or vaccination sites once we do the initial one on Friday, developing it so that, because we'll learn some things from that, but we can do targeted areas.
Right.
But if we're trying to really reach the African American community, and if it's an African American church, the people begin to get more confidence that we're behind it. And that's why I wanted to let people know I got the vaccine, I'm still here, okay? The only side effect I had was a sore arm for probably a few hours. And so that was it. After that, there were no other effects. And so just to encourage people to get it when it becomes available. But that, we can work on that. But I was also wondering, Dr. Cullen, if you could tell us a little bit about your community outreach effort and what you're trying to do to help the African American community increase its number.
Yeah. So let me talk a little bit about the vaccine clinics, and then I'm going to let Jenny talk about our community outreach. What's important to note is that our administrator and our board of supervisors is very committed to what we call vaccine equity, so that we have to ensure that our vulnerable populations, our populations that are not being reflected right now in who's getting immunized, have access. We know that access is an issue, and we also know that being in the community, being with you, is what's transformative there, right? It's one thing to say, get in your car, drive to the state pod, blah, blah, blah. It's another thing to say, hey, down the street at your church from 9 to 3, there's vaccines right there, and we promise we'll be back for the next one, right? So I don't want anybody to think you get one shot and then you're gonna have to flit around and try to figure out where to get the second. We will get you that second. And we have produced and distributed our commitment to vulnerable populations and vaccine equity. And in there is this commitment to do mobile clinics, to do outreach, to do education, to go to where the need is, to figure out what's the most effective way for us to engage with the community? And Jenny's been working a whole lot on community outreach. Yeah, go ahead.
So the vaccinations that'll be at Rising Star this Friday, so anyone can come, they don't have to make an appointment, like right now, you have to make appointments and stuff.
No, you don't have to make an appointment, just show up between 9 and 3 p.m.
If you're within that.
Within that category, 65 plus, law enforcement, clergy, school teachers,
And
etc.
within the community.
And within the community. They're trying to keep it within the community.
Oh, no, in the Rising Star community, like, because someone that live.
Well, right, and I'm glad you asked that question because basically Rising Star is not what we call a community church, it's a commuter church. I have members from all over coming to that particular location.
Yeah.
But I told them we're trying to put emphasis on the people in the community first and foremost. But if you fit within that criteria, you can still come. I told them we have up to 500 shots they're going to give out, and first come, first serve based on the criteria, and that you guys will be back on the 26th of March for the second shot. So people wanted to know that. Another question they asked, for other churches to do what Rising Star is doing, they want to know what's the requirements. Do you have to have a big church, big parking lot, so many personnel, what's required?
Pastor Lewis?
Yes.
There's 3 things that I wanted to share with you, and I'll get to the requirements, but because it falls into one of the things I was going to mention. But first of all, the Pima County Health Department has an active ethics committee that we're working with, and the ethics committee is has membership of people from across all walks of life in the community. Pastor Scott is one of the members on our ethics committee, and their role is to look at the current plans that we have in place for vaccination, the guidance around the prioritization, who is most at risk, who should get it first, because we don't have enough to give everyone a vaccine at the same time. So the ethics committee is made up from very diverse people from across all different sectors, and they're giving us advice on a weekly basis. And we, then the director and the county leadership, look at that advice, but we have been very responsive to the advice that's coming in from the community. The other thing is, to answer your question about the outreach, is that we have an outreach plan to address vulnerable people across all of Pima County. So there are people in rural areas, there are tribal people, and there are people in underserved communities, as we know, and communities of colour. So we are using a formula to look at who is the highest risk communities, where are we seeing the most cases, who is becoming very ill or hospitalised, where are the deaths, and are those communities where other languages are spoken, they have barriers to getting to the pods. So we're trying to remove those barriers by taking the vaccination clinic to the community. And also, when we're in the community, we're also identifying the people that can't get to that site. They're home. They need an in-home vaccination. They may be disabled or have chronic issues or be too unwell to leave their home. So we are able to then go out from the community mobile sites and identify those high-risk people in their homes and take it to their homes. We're putting that plan in place right now, and we'll have more information about how people, if you know in your church community of elders that need to get a in-home vaccination, there will be a place you can go and sign them up, or they can sign up. But I hope that answers your question.
Yes, but also about the facility, I mean, what the church has to have in order for you guys to set up a vaccination clinic.
Right, so that's a really good point, and I haven't been to your church, but I'll probably be there soon. But you have to have a way, remember these are, people have to get there, so they have to be a place where they can drive in and drive out and be safe. So we really pay attention to the geography and if places are safe or not, and we've sometimes had to switch where we think we should go, like we think, oh, that's the best place, but really down the block is a better place. So there also has to be the place where we can set up, right? Like, because remember, after you get your shot, you have to wait 15 minutes, 30 minutes if you've had an allergy in the past. So we need to have a big enough space where we can do that. But we bring all that stuff to the facility. And before we make a commitment, we do like a reconnaissance mission. We go out and we look and make sure, is everything set up so that we can do that. But people have been just sending us emails saying, I'd really like to do this. We do what Jenny talked about, though. We right now are saying, because there's lots of people that say, will you come here? And we're like, well, we will, but we won't right now. Because right now, our commitment is to get immunizations to populations where we have lower engagement for vaccinations. And I do think a lot of that, Pastor Scott, to go to what you said about hesitation, I think some of that hesitation is access. That people, it's just been really hard. You work all day. We don't have clinics that are open at night. You may or may not have a car that can take you. You may have children that you have to watch at home and you don't want to go sit for 30 minutes there. So part of what we really do is try to evaluate what the community meaning Pima County, but also the community in which a facility is, can benefit from us being there.
So then we could call you and say, okay, we're available if you want to use our site, and then you would check out to see if that's within the framework what you just said of the people you want to serve.
Right, and what we've been telling people is we, like Jenny and Erica talked about, we prioritize certain areas where we've seen a lot of COVID, or death due to COVID, because our belief is that those are the populations that we want to make sure have access to really what can be a life-saving intervention, which is the vaccination.
And so like you say, you only do about 500, you bring about 500 to serve 500 people?
Yeah, we bring about 500. Normally what we'll do though is if there's like say you're number 501 and you've waited, normally we right, that would not make you happy, right? So we collect your information and then we try to find another spot where we can get you in to make sure you can get a vaccine. It might not be at that church, but we'll be able to say, here's another spot you can go to get vaccinated.
And I think partnership is key as well, because Pastor Scott and I, we were talking about having the vaccination at our churches, and as with us talking, we decided, okay, let's try to have it at Rise Stop, because you're saying the parking lot, easy access to get in and get out and things of that nature. So we decided to do that, and he's partnered with me to send his people over my way, and along with the other pastors in the community, and I send it out to the other pastors as well to let them know. But I think sometimes we think because the church is in the community, all the members are there, and that's not necessarily the case. I have more people probably coming to Rise and start that live in Reed Ranch than in this area here, because it's a community church, they come from all over. But I think the key is to work with other pastors to make sure we have it available in our different churches so people can come and have access to it. Because people need to feel safe and confident that, they're not, using me as a guinea pig, because some people feel that, they're using me as a guinea pig and something gonna happen on down the road, it's gonna adverse affect my health.
Yeah, I think that you guys, you're servants, you're people of faith, and that there's trust. Your community and your community and your overall people that come to your church trust you. And really what we are here to say is we are so appreciative we have this relationship with you, and we want you to trust us, that we are coming in good faith as a partnership to engage with you and to make sure that we can protect a community that really truly is at risk.
We have
how do you advertise the various sites when you're testing or vaccinating?
We're relying on these guys to do that. Yeah.
Once we got the clearance, we started putting the word out to our congregation. Now they asked us not to put it on social media, so I just sent it to, and they're coming from all over. But I try to be discreet and getting the information out. But like I said, really looking at that list and trying to focus on that list and send it out to the clergy and hope they will tell their people as well, and we go from there. Even when it comes to the clergy, I notice that some people, I have clergy in my church, for example, who are licensed and ordained, but they're not necessarily engaging on a regular basis with people who may be sick with the COVID-19 virus. But I have other people who like maybe deacons or lay people, musicians, whatever the case may be, they are out there on the front line, my staff and all of them, and I need them to have the vaccine more so than some of the clergy. So I'm trying to pick and choose. I'm glad it said faith and spiritual leaders, because I have some faith in spiritual leaders who are not necessarily clergy, but they're on the front line, they're doing what needs to be done for ministry, so I want to make sure they get the shot.
Yeah.
Sina,
Another way that we do advertise is that we have a team of community health workers that represent each community that we work in, that they will go out. So for example, tomorrow they'll be out in the neighborhoods surrounding here and your church, educating, going house to house, sending flyers, talking to people. So we do engage that team out to each community that we're going to have an event in.
See, that was my question. How do we alert the people in the community? Because you say you're trying to go specifically to those neighborhoods, but there's a need in that community. Because I think about your community, about Hispanics that live in that area that don't go to your church, but they're in the community.
Exactly.
So you answered that question. That's good, because I was just making open the people in the community to be able to get there.
I like Pastor Lewis's fact that they're not community churches, you know, because we do have people that come from around, and people that come. One drives 50 miles to get here. I mean, you got to go a lot of churches to get here.
You did good now. Well, they come all the way from Phoenix once in a while.
Yeah, so it's, you know, but, you know,
That's good.
we want to also make sure that we do all we can to assist you in reaching our community, because it cannot just be a church effort. You know, it has to be a partnership. And so first, thank you for
Thank you very much.
reaching out to us, you know, giving us an opportunity to engage in conversation with you. But in the future, if you see ways where we can partner with you in getting our community vaccinated, if you would let us know, we'll make sure that our community is involved, because we don't want to be the poster child for this is what you don't do.
Yeah, I think, and I once again, we're so appreciative that you invited us to have this dialogue, but hopefully it's only the beginning. And this weekend, this Friday, is only the beginning of a lot of work. And you know, there are some good things about COVID. So the one I'm struck by is that COVID has given us this opportunity as a health department to reach out and engage with communities that we probably skittered by each other, but we didn't have the development of a true collaboration. And I'm hoping that this is the beginnings of that for us as we move forward, because you know, there is a time after COVID. And that is restorative and restorative justice and resiliency and our ability to hopefully work together for the future to create a healthier community at the church, but really throughout everywhere. And we really look forward to having that kind of opportunity to work with you guys in the future.
Do you know whether or not El Rio Neighborhood Center is going to have a mobile site?
Well, El Rio, the National Health Service Corps, which runs the federally qualified health centers, has indicated that every FQHC, which is El Rio, will get an allocation of vaccine specifically to them. We've already given vaccine to El Rio, but they haven't done community.
Oh, you're talking about El Rio Health Center.
Yes.
And I'm talking about El Rio Community Center.
Oh.
What I'm thinking is that I can partner with them, because they've got a much bigger parking lot.
They do.
That we could have something in the El Rio neighborhood. That would be a partner between our church and one other church and El Rio.
Yeah, that sounds perfect.
Because the health center, El Rio Health Center is right over here.
Yeah, but they're all over the place.
They are all over the place. Yeah, we'll definitely follow up on that.
Okay.
Good.
But I think the key is though communication and talking about what's going on. And I appreciate Daisy Jenkins reaching out to you and getting you connected to us. We did the COVID-19 testing and we were getting ready to do it again. But I had a business meeting, and when I had the church annual business meeting, you know, we went through all the finances and all the calendar and all that kind of stuff, and so I just asked everybody, how you doing? And so the subject of COVID-19 came up. We spent more time on COVID-19 than the entire business meeting, and it made me aware of the fact that these people are really concerned about this, and they had all these questions, and let's go, the testing, we need to get the shot and all that. So that got the ball rolling, and that's how we reached out and, and to make it happen.
And we do, most of the time it's a webinar because of COVID, but we do many, many community-based groups. So if you need us to, either myself or someone else to be there to run a half hour, we present 15 minutes and then we do a half hour of questions from your community or people you work with, we are more than willing to do that. We do that a lot. We do that for the schools all the time. We do that for businesses. We do that for healthcare centers, and we can do it for churches or anything else also.
We'll definitely keep that in mind. I was fortunate I had Dr. Gail Dean on the line, so when we did the Zoom meeting, so she was able to answer a lot of the questions. She's the chief of staff out there at TMC, so I was thankful for that. But it made me realize that we really need to have something for our church and for our community because people really want to get the shot.
Right, perfect.
We won't be there Friday because we're having a memorial service for someone who died from COVID.
Oh.
So it's one of those things where we have to make sure our community is caught up.
Right.
Because it is impacting us.
Right.
In fact, I don't know if Pastor McDowell would mind sharing, but where he actually had.
Oh, yeah.
So,
July 23rd of last summer.
Wow.
And I was in the hospital for 2.5 days with pneumonia. Thank God I didn't have to do a ventilator or any of that. I went home with the oxygen. Mm-hmm. And it took a good 6 weeks afterwards for my lungs to feel pretty normal.
Yeah.
Right. We've had several pastors in our convention who've had the COVID-19 virus, so it's real. And several of our pastors have lost members to COVID-19.
Yeah.
I did a funeral last week.
Oh, yeah.
In fact, I'm doing one Saturday. They had other issues as well. And the reason why we're not having it on a Saturday, I preferred to have it on a Saturday, but I got a funeral person, been in the church, founding member and all that. It was already scheduled, so that's why we're doing it on a Friday.
Yeah.
But in the future, we would definitely try to have it on Saturday when people are not at work and trying to go to school and things of that nature. But this is as soon as we can have it. I figure the sooner the better.
I think we'll probably have a good turnout though.
Yeah, I believe
Because the older people, when you get into the younger age group, then we're going to have to do some more sales.
Right, yeah.
But at this age group,
Yes.
they're really excited about
Oh,
it.
yeah.
Right.
What our church is doing is we have a senior ministry, and so we have all the names of the seniors. So they're phone calling people to let them know.
Right.
So as the word gets out and as other churches are able to be vaccination sites,
Right.
we can now, from what we've learned from doing this,
Right.
give that information to them so we can have more effective communication. So I'm excited about what we're doing, and I really am looking forward to turning our numbers around.
Right.
I think pulling us up from the single-digit percentile, of percent vaccinations is a goal.
Yes.
And I think it's an achievable goal. We just have to do what we can as far as communicating with our community to make sure that they know this is where you go, this is when you go, this is what you need to do. Because they were asking me questions like, well, how do we register? So I talked with Erica, and she shared with me they don't need to register.
Right.
So no one said, okay, I've talked with a few people that were hesitant, but just from talking to them, I was able to get them to see, that it just makes sense to do. But to find out they did not have to register, all they had to do was show up, that set a lot of people at ease.
Right.
So if we can do something like that in the future, we're going to get a lot more people.
Yeah, that's our plan.
A lot more people.
Okay.
That registration process is I was able to do it. Some reason or other, my wife is very good with computers. She just could not get hers done. And finally, my son did it for us.
Right.
Well, see, that's another issue we have to be concerned about in the future in the African American community, particularly dealing with seniors, is access to technology.
Right.
I mean, our church, we have...
And how to use it if you got access.
Right. Our church has internet, the service on internet. But we also have where you can dial up and listen in. We have people who don't know how to computers. So, we need a way to walk people through if all they have is a phone number.
We do have that, Pastor Scott. If people don't have access to a computer or don't have an email address or can't navigate that system, they can call the main helpline number, the 222
222 something.
0178 or and we'll get you the number.
Perfect.
And they can tell the people on the call centre that they don't have access to a computer, and they will take their name and number, and another team will call them back and help them to get scheduled because they can't get through the current system. So we do have something in place to help with that.
That's good.
And when you give me that information, I'll send it to everybody, because many of our churches have ways of contacting their adults, seniors. I mean, to say that we're going to announce it on our service on Sunday, if you're watching us, you have a computer. So, but many of us have ways of communicating that we can use to be effective.
And the other thing is, we are aware that some people don't have transportation, or their transportation is their son or their daughter who's at work during the day and can't take them. So we do have a mechanism in which we can provide transportation. And we also, state Medicaid access just changed it so that if you are on access now, you're able to go get a vaccine, and access picks up your transportation to the vaccine, the wait with you, and then send you back. But so we've been paying attention to that to make sure that the obstacles that we know exist, which there can be a lot of, are there. I will say my husband, who's your son to it, my husband had the same situation. I was like, really, you can't figure this out? And he goes, no, I can't. And my daughter did it for him. So we know it can be difficult.
What about vaccinations for children?
So right now the vaccines are not approved for children, but NIH has indicated that they have initiated vaccine trials for children. We expect we'll get those results in 4 to 6 months, but in the meantime, we just recommend masking. And as everybody goes back to school, the recommendation from the state level and obviously the local level is for kids to wear masks and teachers and staff to be masked in the school system. But right now, there's no option for immunization for children.
And I don't want to be the one to ask us all the questions, but with congregate settings like we have a church service, is there a recommendation for how many people can be in the building physically?
Yeah, that's a great question. There is a recommendation. It's ideally you do it by square footage, and but this won't be reassuring to you because it's not very many. It's one person for every 100 to 150 square feet. So, yeah, so it's not very many people. The caveat to that is that we really do recommend the 6 feet, 15 minutes, and at ventilation. So opening doors and windows and letting air come in is a huge benefit to it. But, compliance with masks, hand washing, the 3 W's, wings. I had a veteran tell me that it's not 6 feet, it's wingspan, how out your wings can be, can really help limit transmission. Those are the key things. And obviously, if people are ill, to not come.
And there are special filters that can be put into your air conditioning system that can take the stuff out of the air or something.
Yeah, there are. And then the whole thing about UV light, and there's a lot of research going on right now with UV light. Some of us actually think, when I go to work really early, and this morning I was in my car around 6 and it started to get light, which I love that that's happening. And I thought, oh, the light, that's what's going to help us. We really truly believe that UV light exposure probably decreases viral transmission. So as it gets this time of year, you know, we're seeing our numbers go down a lot. They're not gone, so people still need to be really respectful. Even if you've had both vaccines, you should still mask and distance and wash your hands as much as you can. But, you know, our numbers are, as I say, they're like this. We have a slope, a downward slope. So hopefully we'll keep going that way.
So it sounds like outside services is better.
Definitely better. The more you can do outside, the better.
I love online.
Yeah.
Pre-recorded.
I have the number for you all. Would you like me to give you the number and say it on, it's,
Yeah.
2,
Pastor Scott don't believe it. Pass it to us.
2,
I got you. 222.
0, 1, 1, 9.
22201.
222-0119.
I really appreciate you coming
Great job.
and sharing with us, and looking forward to a greater
Yeah.
working relationship as we come on the other side of this.
Right.
So thank you for the work that you're doing. And when I suggested, I think it was to Jenny or to Erica, it was within a day that you said, sure, let's do that. So
Yeah.
thank you for your responsiveness. That shows a deep commitment. We're going to do everything we can to help the community. And anything you come up with, an idea that you come up with, if you run it, just let us know how we can help, and we'll be a part of trying to help us rid the city of Tucson and Pima County of the COVID-19 virus.
Great. Well, thank you very much. We're real appreciative and grateful that